going to call it out, United Healthcare of Texas, shame on you, denied a person who has basically been completely independent and walking around Disney 3 months ago to having a broken leg, Wernicke-Korsakoff syndrome in the beginning stages, and B1 thiamine disorder from malnourishment from a gastric bypass, which causes the Wernicke syndrome, and needing really acute care, 3 hours a day rehab. And the managed Medicare said, no, she doesn't qualify. And what CMS says are qualifiers for acute rehab are that you need 2 therapy disciplines, that you have to have a doctor check in on you daily, which if she doesn't get her labs checked, she'll be right back at the hospital with deficiency of B1 vitamin, which causes the confusion and the short-term memory loss. And in the beginning of Wernicke-Korsakoff, it is reversible when you lose your ability to walk and function and have neuropathy. But if you don't get to an acute care rehab and get the right amount of therapy, the condition can become chronic and permanent. And so I was able, with the grace of the Lord, to quote CMS guidelines, get a great representative on the phone with Managed United Healthcare. And if there's one thing that I can say to any Medicare recipient out there, if you can afford traditional Medicare and a supplement, do not get managed Medicare. Do not listen to the, I'll give you 40 hours of caregiver a week. It's baloney. It's not true. They don't give any extra money to agencies to provide that, but they tell the client they're providing it. They say, oh, we'll give you dental, we'll give you vision. Okay, you'll get a cleaning and an eye exam, but that does not pay for any root canals or fillings or glasses or contacts. As an advocate, I have resources with dental offices and with eye care offices that will give self-paying plans for all of those hard things. They also say we'll give you a gym membership. I'm not going to say that if you're 65 and older that you can't go to the gym, but most of the people that are on a managed Medicare plan are in a wheelchair or can't walk. And what the heck is a gym membership going to do for them? I'm just asking. So managed Medicare, you should be not able to advertise. You should not be able to switch people. It is wrong, wrong, wrong. And we shouldn't have to fight for 8 hours to get an appeal that if somebody had traditional Medicare would have been an automatic yes. The rules should be the same for any Medicare client, period. Shame on you, United Healthcare president, for making millions of dollars on the backs of grandmas and grandpas that put you where you are. Have a great day.